Santa Kendrick, 105.1 The Buzz with Daria, Mitch and Ted.
And
the doctors.
2 doctors. Yes, you heard right. No, that...
What? 2?
Don't adjust your radio. So we have our friend Dr. Michael Workman in here. And we thought that we weren't going to see you till actually the end, like after July, but you're in here to introduce Doctor number 2. I mean, not not in stature or anything like that, but
No,
it's
absolutely.
a second doctor.
Yes.
And that's Dr. Do you like Dr. James or Dr. Jimmy? Chan.
Jimbo.
Dr. James Chan.
Can we call you just J Chan?
Sure.
We'll call you Dr. Chan.
That's
like
going to
that.
be that'll be your rap name.
Welcome.
So tell us who this guy is, and then we'll let him do the same.
Well, Dr. Chan is, I think, probably the best facial surgeon in the Portland area, and that's why I've partnered with him. He's Stanford trained, and he's just a whiz kid, but more than that, he's just a great person, and patients love him, and I think I'm really excited to be working with him.
Excellent. So were you, Dr. Chan?
You look awfully young, Dr. Chan.
Right?
I don't
knew,
care for
no,
this.
I'm serious.
When
He's
your
younger
doctor
than even me.
It's all the plastic surgery.
Just tell us you're like a Doogie Howser and you went to college when you were 10, right?
Exactly.
Okay, we can take that.
I knew you were going to. So we went out to dinner with Dr. Chan and Dr. Workman, Ted and I.
Yes.
And
I was house hunting.
yeah, and Mitch didn't go. And,
Sucker. It was-
yeah, we had
it
the best.
was
We had
awesome.
so much fun without you.
Yeah, I can understand that.
And I was trying to anticipate questions that you might have after a couple cocktails.
Yeah.
But then I figured that those questions are probably questions better not asked.
They were all about whether he had a boat, if he could come to your house.
But
I'm a
why
delight
don't-
to have over.
Why don't you ask the questions about your own face that you always ask all the time? when
Because
we have
I've heard
doctors in?
different things from different
Exactly.
surgeons.
Yeah.
So what would you do about the double chin here, Dr. Chan? Is it something you can do? Because I guess that the challenge is whether or not my skin's going to go back up into my head.
He wants, Mitch feels that his chin...
I want a Rob Lowe
his
jawline.
His jawline is too, shall we say, doughy.
It's quite. My face is gigantic as I'm getting larger. Even when I was a kid, my brother called me Count Face a lot.
You're getting spread head.
I have a big head, a big face. What would you do?
So, well, first of all, how old are you?
I'm a very young 48.
48?
Yeah.
So you're right at that age where you have a lot of options. You have surgical and non-surgical options.
Excellent.
Yeah, so absolutely. If you were to do something like liposuction, you worry about whether that skin's going to contract. But there's also something called ultherapy, which we've been doing in conjunction with liposuction.
And Daria did some of that, didn't you?
Yeah.
Yeah, you're a fan.
Yeah, I'm a fan.
You look great.
You should see, and it's something that comes on gradually over months. You'll look instantly better immediately because you'll get really, really tight, and then it'll sort of relax a little bit, but then it stimulates collagen as well as tightening things, right?
Right. It's focused ultrasound, so it directs the energy under the skin, and it creates collagen over time. And I think combining that with a little bit of liposuction will really give you a nice result there.
And it's
I'm in.
kind of a brand new thing, isn't it?
It is. It's fairly new, and there's no downtime with the ultherapy. And lipo is very little downtime, lipo in the neck.
And what kind of device would I wear after lipo in the neck? Some kind of like I have a toothache?
Oh, please make him wear a toothache.
Yeah, it's
thing.
like you had the mumps. There'd just be a scarf around your head, tied at the top.
Do you wear something?
You do. We have you wear it's like an ace bandage
Okay.
over your head, and I just have my patients wear it for about 3 days. That's it.
And so you can go back to work?
You can go back to work with the ace bandage on.
Oh, that wouldn't be good. Not
Yes,
with
it
these
would
two.
be
Good.
very
It would be
good.
very
It
good.
would
Good
be
idea.
Amazing
fantastic.
shows.
Not good
It
for
would be
anybody.
the 3 best days
Is there
in our
bruising?
7 years.
Bruising from either of those procedures?
It depends on the individual. Usually there's not a lot of bruising and not a lot of swelling.
All right.
I'm hoping there's a lot, though, in your case. I'm hoping you're the rare exception patient that
His whole head blows up.
Great.
swelled up more than you've ever seen before, and you just came in here looking like Charlie Brown meets the Great Pumpkin.
Oh, no,
and
I'm
you got
almost
this
there.
big thing tied with a little bow on the
Like
top
Leonardo
of it.
DiCaprio, this giant head and this tiny little face.
Exactly.
no.
You'd be a Charms blow pop
Great.
with a little face in the middle of it, talking on the radio.
All right.
Please let it happen.
Okay, I think I'm going to have to schedule something.
888-733-5105. If you have questions for Dr. James Chan, he really, what you do every procedure involved with the face, but what are some of your
Specialties.
sort of you kind of like, I love doing this, and frankly, I'm pretty damn good at it.
So facelifts are probably my number one specialty. Also nose and ear reshaping, eyelid lifts, and I also do a lot of reconstructive surgery on the face.
So it sounds like you love the procedures that have a strong artistic element to them.
Correct.
And that are quite transformative, that will make people feel like this is what I wanted, like this is how I wanted to look afterwards.
Absolutely.
Yeah, when we went to dinner, we talked about that a lot, about how you really got into the artistry of doing this, that you are crafting someone's face.
I love
which
it.
is really wonderful.
Yeah,
Yep.
I love it. Kind of like the video. Where
Hello?
Yes, where the blind girl
Is it me
makes a
you're
clay
looking for?
Lionel Richie face.
Fantastic.
The fact that
Dr. Chan is better than
the
that
fact
girl.
that I said kind of like and Ted knew instantly
exactly what you're
it was
talking
the
about.
Lionel Richie hello video, it frightens even me.
Spooky.
888-733-5105. If there's something about your face that you would like reshaped, altered, changed, improved, even something as minute as skin tone or clarity, then give us a call. Ask your question with Dr. James Chan. Sorry, or Jay Chan. He'll rap the answer to you.
Sure he will.
888-733-5105. Questions for the facial plastic surgeon, new to our studios, but hopefully a new permanent addition.
Yeah, he's a delight.
888-733-5105. Your questions coming up.
Dave Matthews Band on the buzz.
Yeah.
So are you asking, will it still look like your nose when the crooked part is fixed?
Pretty much. I mean, it's my husband's nose. He has to, like, push it over and able to, like, breathe out of both sides. But I'm afraid if he gets it fixed, it's not going to look like him. But on the other hand, I understand where he might want to breathe better.
Well, what we usually try to do is we talk to the patient about what they want and how they want to look. We try not to change them too much. We want it to look natural. We want it to look like you, but just better.
Okay.
I talked
His
to...
mom got it fixed, and she looks totally different to me.
I took that it varies so much from surgeon to surgeon. We talked to Dr. Chan a lot about this very fact, and he wants to maintain the integrity of your ethnicity, so you still look like you belong in your family in terms of your genes and genetics. You just look better than you did before, and sometimes it's hard to put your finger on.
And he can breathe. Yeah.
Also, the other thing that we often do is something called computer imaging. So we'll actually take some pictures of your nose and go over in detail what changes we can do and what would be realistic. And you can kind of guide me as to what you want, and then I can tell you what's realistic. And usually we come to a conclusion as to what looks good.
Okay, cool. Thanks.
And can you do that procedure, the computer imaging, with other procedures such as the liposuction
I was
of my
just
giant
you have one
chin?
picture. You have a picture of Mitch's face, and then you have a picture of Rob Lowe,
And kind of
like
push us
circa
together.
1990, and then you
Morph us.
just try to morph and
Where the
figure
dollar
out
sign is how
and
much it's gonna cost the closer I get.
Split the difference.
Our guest is cosmetic surgeon Dr. James Chan. Gary, you're next. What's your question?
I had a question. Is he, like, for face tightening and reducing wrinkles, use the Botox or the Mars, which would be better?
Or is there another option?
Well, so it depends on a lot of things. It depends on what specific wrinkles you have, what type of skin you have, and what, that will determine what you'll benefit from. They work completely differently. Thermage is designed to help increase collagen. It's, again, sort of a long-term process that will, over time, help you look better. Botox is more instantaneous. You're trying to freeze the muscles from activating so you don't have those frown lines that you develop when you move your face.
You could also try decoupage, which is where you...
I love decoupage.
You shellac bits of other people's pictures of skin onto your face, and that will shrink and tighten up
Thank
the
you.
entire
I
area.
would try that, yeah, like a reverse Benjamin Buttons. I could do that.
I hope that helps.
We certainly do hope that helps.
Dr. Chen, what is your website? Your website should be better. You have so many pictures that aren't on your website, can I just say? But it's a great way for people to contact you right now. We'll work together on getting more, but we need more before and after
Absolutely,
pictures.
that's our favorite part.
Absolutely. But where can people go now to get in touch with you?
So they can find me at drjameschan.com.
And that's DR, doctor, I'm assuming?
Correct.
All right.
Excellent. You sound like a Star Trek character.
Dr. Chan.
Speak very logically, very cleanly.
And Dr. James Chan just fits somehow.
Perfect,
yeah, I'd like to see it in an upcoming movie, perhaps.
We'll see you in a couple weeks.
Thanks, Doc.
Thank you.
The happiest place on earth just got happier. And